Dr. Bart Rademacher, and this is Prescription for Your Transformation. Real people, real conversations, and real success, and really tapping into that authentic genius within us. There's an intelligence that we all have access to, but unfortunately, no one ever really taught us how to do it. And I talk about the brain intelligence, the body intelligence, as well as the energy intelligence. And as science develops, it's kind of interesting as we look back on the origins of science and where it's actually going. And there's a lag actually into, stepping into that future. Some of us are really just sort of stuck on some of the things that we've learned in the past that are probably very antiquated, and so not as relevant as they really as we would really like them to be. And what I mean by that relevance is that with new knowledge, then we understand how things have become irrelevant because that knowledge is no longer valid. And what am I really talking about? Well, medicine is really based on Newtonian physics. And Newtonian physics, when you look at it, when you put that in perspective, has really three major elements, and that is materialism, then reductionism, as well as determinism. But with Einstein, who brought up the theory of quantum physics, a lot has changed. And as we evolve into that realm, things are changing as far as our perspective of our body and how we can influence that. And so for today, what's important is to understand an area of medicine or human physiology that has really been forgotten or taken for granted, or just quite frankly been ignored because it just seems so irrelevant. The truth is, to the opposite of what I said earlier, is now this is becoming very relevant as we begin to appreciate the importance of our lymphatic system. And so it gives me great pleasure to introduce to you Lisa DeFalco, who is one of the national or the national leader in manual lymphatic drainage in the United States, a great proponent, for this modality, and really an inspiration for all of us, how it is that we can incorporate this into our lives. And if you're practitioners, into your practice, so that you can actually elevate the health and wellness of the communities that you actually serve. So Lisa, thank you so much for joining me today.
Thank you, Dr. Rademacher. It's really a joy to be here today, especially right now.
Well, thank you, and I feel the same way, because the truth is that just our short talk before this interview, I learned a few new things about you, and how you actually are leading the way in this modality in our health system, and it's such an important part of our own health and wellness that very few people really understand. And as part of the master class that I'm putting together for practitioners, I think it's so relevant that they hear you today. But truthfully, it's great for everyone out there. So wellness
Yeah.
practitioners as well as consumers to understand how the access to our personal wellness through lymphatic drainage is so easy and accessible that we should all be doing it on a regular basis.
Absolutely, Dr. Rademacher. And I think one thing people would ask you as a physician, especially in light of the whole COVID issue for the past year, is what could I do to improve my immune system response or health? And this is one of those modalities that can be used to do that safely without having other side effects that are, maybe a drug that a patient can't take because they got other pre-existing conditions.
Well, so let's get in absolutely. So let's get back to the basics of it. And the
Mhm.
metaphor that I think that's great is simply this: is that you have a country, right? And in this country, you have all these rivers. And just imagine that these rivers are the pathway to remove the toxins of your body. But just think of a stagnant river, sludge in this river. What's going to happen to that environment? What's going to happen to the landscape around this river? And it's going to be toxic. And the truth is, that's exactly what's happening with our lymphatic system. If we don't take care of it adequately, there's a sludge, in our tissues, the toxins remain in our tissues and they're not being effectively removed. And putting it into context, when you look at the lymphatic system, it is actually the first circulatory system that our body had in our fetal phase. And so this is how the body was able to supply, all the nutrients that the, vastly growing cells required, and the enormous amount of toxins that were being released. And so through that lymphatic system, there was the supply and the removal, of all these different products. And so through the development, then of course, then we had the arteries and veins that took over that major role. But the truth is that our tissues are very much still dependent on the lymphatic system. And when we look at it physiologically, probably about 50% of the removal of products and toxins from the tissues is dependent on an effective lymphatic system. And again, please, Lisa, anything that I say that's incorrect, please correct me. You are the ultimate expert in all this, and I'm still basing on some of my old, anatomy lessons from many years ago.
I love it. You're doing excellent. And I think people can really relate to the way that you're presenting it. And that was half the challenge. We didn't have a way to really educate the public in a way that they would understand what the need is for this lymphatic drainage. So I think that was very beautifully put when you said there's this toxic backup through the rivers, which in our body is the lymph system. And we know in reading just recently how most diseases begin with inflammation.
Right.
So, Dr. Rademacher, I'm putting the ball back in your court. What is inflammation? You're the doctor. Tell them.
Yeah, and that's very interesting that you're saying that, because it's really in the recent years that we've begun to recognize, how inflammation is part of every disease or every condition or illness that's occurring in our body. And once again, it's something that, for whatever reason, we just didn't realize how important it was. We understood inflammation and said, yeah, sure. This is something that we got to address. And, you've got an infection, or you've got an immune system, immune disorder, then yes, you've got inflammation. But me included, kind of took it for granted. And recently, with the studies in regenerative medicine, I've understood that pretty much every condition, any medical condition, has a component of inflammation. And inflammation, for a larger part, is causing all these chronic diseases. And now there's been a great push to understand inflammation and its contribution to all the different medical conditions. And what's interesting about that is that when we start looking at the sources of inflammation, for example, the foods that we eat, as one example, how preventable it really is. But on the other end, if there is inflammation, part of the component of that is the fact that these toxins reside essentially in the tissues because the lymphatic system can't remove it. And so one of the key things that you said to me earlier on, which I thought was important, as I was asking you, what are the three key things about lymphatic drainage that you want people to know? And and again, I'm a culprit of this as well, as just taking things for granted. And that is, most people look at manual lymphatic drainage just a treatment for lymphedema. Well, the truth is, now that we understand that the lymphatic drainage or lack of it is such a major contributor to all conditions, lymphatic drainage is a component to all treatments.
Yes, in fact, Dr. Rademacher, I think this is really the quantifier here for why we need MLD. I don't think most people know that you are getting manual lymphatic drainage every day.
Yep.
This system was designed to clean itself out. How? By drinking water, by eating healthy foods, through exercise and movement, which propels this fluid to get to the lymph nodes to eradicate the toxins and then pick up the healthy lymphocytes. When we're doing everything in a perfect world as right as we can, it's doing that naturally. But the problem and the challenge really for this past year is people have been limited about going out. More people have expressed putting on weight. They're eating things that aren't good. So in a time when you really need that immune boost, they're not getting it because the lymphatic system is slowing down and in some cases shutting down for people. And here's this beautiful modality that will kind of jumpstart that and get it back up and flowing again and not stagnating and causing all these fires in the body. We can put those fires out. We know that we have a tool now.
You know, recently there was a new coding for an interesting disease that many people would also think is not relevant, and that's called a sitting disease. And the sitting disease actually technically has a higher risk of smoking for cardiovascular problems. And, you know, as soon as you sit for about 20 minutes, then the enzymes in the endothelium start shutting down to process the lipoproteins, the fats. And as a result, then you start accumulating, cholesterol in the vessel walls, and they get hardening of the vessel walls. And so now they're talking about, well, you've got to move every 20 minutes. And, so I better put my clock on so that I can step up and jump around for during this interview, which I won't, by
Yes.
the way, so I'm not following my own rules. However, it is important for us to move around at least for a minute or two every 20 minutes. But in all these conversations, the focus has been on that metabolic effect in the endothelium, but nothing on the lymphatic drainage, which I find fascinating, unless there's studies out there that that I'm not aware of. But the general conversation still has not included manual lymphatic drainage or just lymphatic drainage in general. And clearly, with any kind of activity, you're massaging the lymphatic channels because these channels don't have their own internal muscular system or pump system. They have valves, but they don't have the muscles to really pump it. And so it requires the tissues around them to essentially compress to push the fluid through the system. And so what are your thoughts about that? The fact that, it's being ignored so much.
Well, to be honest, an MLD practitioner, we feel frustrated. And yet at the same time, we understand what the problem has been. So just to make this a little clearer for our audience is that back in the 1990s, when I started doing this work and I worked for the surgeon who brought MLD to the United States, he set up the first clinic. A very intelligent man, just like you, Dr. Rademacher, a mover and shaker. And the medical community did not readily embrace this lymphatic drainage. And what we found through research was that the average medical healthcare program only addressed the lymph system for 20 minutes. That was doctors, nurses. So you're talking about our whole healthcare system getting 20 minutes of education in the classroom. And then that meant problem number two was we needed to get textbooks to start re-educating or better educating our healthcare professionals. And that was going to take all this time, almost 20 years. And through the help of this research where they discovered the lymph vessels in the brain, and then they said, oh, now we need to rewrite these textbooks. So I'm looking forward to our next generation really carrying this torch forward. But there is still stuff that we can do right now to
Yeah,
improve our overall health.
yeah, later on in this interview, love to hear about that research that you mentioned. But just give us a perspective on the history of the development of manual lymphatic drainage, who essentially originated it and how did it come to the US?
So that was with Dr. Emil Vaughter, and this is a European-based treatment that he designed originally for sinusitis and upper respiratory. And he got some amazing results, though. Besides relieving congestion of the head, neck, and face, he found that it was clearing acne, rosacea, eczema, swollen dark circles under the eyes. He was getting all these other benefits, which really led him into working with the medical community there. And even till this day, there are clinics of lymphology. So let me ask you, Dr. Rademacher, have you seen a clinic of lymphology in the United States? Because I know you've traveled the world.
Nope, I have not. And what's
So that
interesting too, my own personal history with you is was an interesting one because I had this revolutionary med spa, if you will, which is really advanced in this sense in many respects because it really incorporated so many different modalities. And I was very intrigued with manual lymphatic drainage, and our story was interesting and funny because I had no clue of what lymphatic drainage was. And this is after one long day of work. And I was just looking forward to this wonderful massage because my staff had introduced me to you and says, oh, great. I'm going to get this incredible deep tissue massage because that's all that I was thinking. Because, yeah, you need to really press hard to get those lymphatic channels to work. And then then I see you come in. I thought, oh, I was expecting this big Swedish, woman, strong woman, if you will, and no criticism or profiling, by the way, but just that's the identity of massage therapists that came from Europe and what I grew up with. Of course, there's many others that are excellent at doing it, and they're kind of petite and tiny. But the point that I'm getting at is that you weren't this strong woman that I had envisioned to give me this, therapeutic massage. And then I'm laying on the table in my spa, and then you start doing this massage on me. And in the practice of my spa, sometimes I would come across people that it didn't quite impress me because I didn't think they knew their stuff. And so I thought, oh, here we go again. Here's somebody who really doesn't know what they're doing. And I got all this hype of this incredible person. And now I'm just getting this really light touch massage on my body. And it's like, okay, what is this? And being that polite person was saying, okay, well, I'll just be nice. And so I thanked her at the end of this really light, barely feeling any kind of massage, disappointed that I didn't get my deep tissue relaxation of my muscles. And I was fascinated the next day when some of the swelling in my legs, because I stand a lot, was completely gone. And then it dawned upon me that, wow, this is a revolutionary type of modality that I wasn't aware of because this swelling in one of my legs, I have a bit of a venous insufficiency. So this is maybe too much information for me to share on this platform, but it's personal and it made a big difference for me. And that's when I called you back and says, oh my gosh, look at what you've done. I need to know more. And I share the story more specifically because I think so many of us have this idea of what this is, and it's completely inaccurate. And it really, so many are underwhelmed by this manual lymphatic drainage concept. Well, quite frankly, it should be a really important consideration in all of our health and wellness because of the impact it really has. How a gentle touch can really help detoxify your body.
Dr. Rademacher, you actually said something that was really important, especially for the therapists that were listening. If you heard what Dr. Rademacher said, he had chronic venous insufficiency, and therein lies the difference. The need for massage is for muscle. The need for lymphatic drainage is for the edema that's coming from the lymphatic system. So this is why massage therapists in particular are told not to massage people with chronic venous insufficiency. The pressure would be too great for that condition, but yet lymphatic drainage is indicated. And I've actually done presentations for the board of vascular surgery. They are picking up on this lymphatic drainage for just what you mentioned, Dr. Rademacher. So thank you for sharing your,
And and
your
I- and
personal story.
and I share that with a very particular intention, and that is to help people understand that this is a very important modality that so many of us just simply have ignored or disregarded, and because it's not fancy enough. And so that's why it's important for me to share the story and how I myself was a culprit to that as well. But continue with your story on the history. So voter, was the one who essentially developed it, and then how did it ultimately come to the United States?
We're talking about pre-internet times. So pretty much the Clinic of Lymphology, the establishment of the modality and the medical community surrounds him there in Europe. And the price tag at the time, we're talking 20 years ago, was about $5,000 a week to get manual lymphatic drainage if you were an American flying over to Germany or to anywhere in the area. So it was cost prohibitive and pretty much off the radar for the average American citizen, didn't even know about it. And it would be the doctor I work for who heard about it from one of his patients who had edema and went to Germany and comes back. And like you, Dr. Rademacher, he sees, you want to talk about evidence-based? A swollen arm that left the country comes back and it shrunk, and he wants to know how, where, when, and why. And that would prompt him to leave New York and go to Germany and stay there for 3 years to learn this whole program that we didn't have in the United States. And he's inspired and wants to come back and set up and start establishing clinics of lymphology here. So
So,
that's how it got here.
so one of the things that I found interesting, your story as well, and as we talk about this in just a little bit, and I still want to dive into the science that you talk about on the brain, but as we talk about later on, is how it's been impacting, how the changes and the trends in medicine have impacted, how we serve our community and how we need to serve them in the future. And that's a lot of the work that
Yeah.
I'm actually doing for my master course in helping practitioners, regain control of their practice, and and being able to survive in, quite frankly, the environment that isn't really conducive as for practitioners to thrive in this environment. But share with us a little bit more of the science, and particularly as we discover more lymphatic channels in the brain.
Yeah, so this is really the game changer. I call it the paradigm shift was in 215 when they discovered the lymph vessels in the brain. It was the first time, Dr. Rademacher, that I've ever seen them put $5 million behind further research with a time limit too, for Dr. Jonathan Kipnis to investigate these diseases of the brain, central nervous system. So we're talking like dementia, Alzheimer's, CTE, um, Parkinson's, all of these. I thought that's amazing because we never saw them put that much money toward lymphatic studies. And he was backed and he's been working on it along with other researchers. And it's been coming blazing to the surface almost on a monthly basis. If people watch, if they want to join us on MLD Institute International platforms, we put it up there so you see what the researchers are discovering and how much of a player the lymph system is in the brain. So I want to highlight this one thing. I always compare the lymph system to the plumbing in your house. If the plumbing breaks or you got holes in your pipes, you're going to have leakage and you need to get to it right away because if you don't, you know the mess it can be. And that's what's happening in the brains we found with CTEs, like in our professional pro sports, which is why we work with them. Head trauma breaks those lymph vessels, contents leak out. And if not serviced, it will stay in there, remain, and become thick and hard, which later on in time is called plaques and tangles that leads to dementia and Alzheimer's. So this made the headlines in the news. From the New York Times to Good Morning America, you name it, it was all over. And that's why people, and I've seen at least 100% more emails and more phone calls. People are wanting to understand this immune system now because it's making the headlines.
So explain a little bit about the anatomy for those who's not quite familiar with it, the physiology of the lymphatic drainage, where it drains, and actually how a treatment is performed.
So I think the easiest way to describe it, especially in the clinic of lymphology, they refer to this as a half open system of transportation. So unlike your circulatory system that has a heart and the blood's going around and around, that's why we call it circulatory. The lymphatic system is like a highway that has entrance and exit ramps. That's why if you burn your finger, all of a sudden you get a blister. That lymph is exited to put the fire out, and it surrounds it with healthy lymphocytes to protect you until you're healed, and then it goes back onto the pathway and this little blister disappears. So this is how your lymph system is working. So when we do lymphatic drainage, understanding where these main roads, highways, and side streets are, we can do lymphatic drainage in 50 minutes and accelerate the removal of those toxins and bring the healthy lymphocytes in 10 times faster than it would typically go on its own.
Oh, wow.
And that's why we accelerate this healing process. This is what gets rid of that inflammation so quickly.
So the channels themselves, they're, what size are they, and how are they distributed in the tissues, so that, the listener can understand, the difference between, deep tissue and superficial
Yes.
massage.
So that is a great question. The lymph vessels in diameter compared to your veins and your arteries, they're about the size of a hair. So they're very, very tiny. So if you flip your wrist and you look, you'll see your veins, but you won't see your lymph vessels, even though they're more superficial. They're right there a millimeter down in your skin. But wait, there's more. The lymph vessels go all the way down to the periosteum of your bone. So for anyone that's suffering with arthritis and the inflammation from it, you're talking about an autoimmune condition that involves your lymph system at the deepest level. Now, the beauty is there are vessels that connect superficial to deep. So we don't have to go down deeper and harder to get down to the lymph vessels down around the periosteum of your bone. If we work up here, these connecting vessels called perforating precollectors will draw all that material up so we can clean you out deep and superficial without hurting you.
And so where's the natural flow that goes centrally, which empties into the lymph glands? Is it more from superficial to deep than to the lymph glands, or is it more deep to superficial than to the lymph gland?
So it's more from deep to superficial, but also you do have a main structure. There is one vessel that is the largest vessel. It's about 13 inches long, right down the center of your chest. And you said something key earlier, Dr. Rademacher, so I want to focus on it for a minute. At the base of this large vessel, there's a cistern. They actually call it the cisterna chyli, this little pouch here right around your abdominal area, which if anyone's watching, they're probably sitting like we are right now. And it's compressed because we're sitting, which means the lymph in your legs can't get up that pouch because you're sitting. What Dr. Rademacher said is true. Every hour, at least every half hour is even better, get up and move, because otherwise the edema with gravity is sitting down in the feet and ankles. And that explains why so many people have cankles from sitting so long.
And you'd think that shouldn't happen, but it does. So it empties into the
Yeah.
thoracic duct, correct?
Yes, yes. And then
Um,
from thoracic duct, it goes into the venous system. Those healthy lymphocytes up in this region, the left and right venous angle, all those hopefully healthy lymph will dump into the bloodstream.
so so what's interesting then with the type of massage, and this is a key point that I think most people don't quite appreciate when it comes to manual lymphatic drainage, including therapists who use all sorts of crazy devices. And love to hear your thoughts on that. But the massage is quite frankly, I mean, if you just apply several of your fingers, very gently on the skin, that's it. This is, tell me if I'm doing this incorrectly, but this is the type of massage that people are getting. And if you're just listening to it, just put, three of your fingers, the tips of your fingers on the backside of your hand, and just very gently apply pressure in a rotating motion. That's what what the massage is all about. And again, when you apply too much pressure, what happens?
then you get a massage. Because what's happened is when you put too much pressure, the lymph vessels here, it's kind of like a balloon and it kind of flattens out. So it's not promoting lymph flow. Now you bypass that and you've gone into the muscle tissue. So you're going to go into massage, which feels good too, but
So
you want the
basically,
lymph system.
you're obstructing the flow, and as you so eloquently put it, you got these up ramps and down ramps, and so you're pushing everything outside of the lymphatic channel and back into the tissue. So you're
Yes.
counteracting the not only by obstructing, but by pushing everything back into the tissues. Is that correct?
That's right, Dr. Rademacher. And that's why, especially with people with lymphedemas who already have a compromised system, that's why we don't want them to have massage because they'll go in too deeply and that actually increases the inflammation as the edema is going now in the interstitial space through a broken system at that.
So you and I have something in common, which I just found out today, which is awesome, and that is we have the foresight, we have the view of the future. We imagine when we look at the trends, when we look at what's happening, and we can imagine what's going to happen in the future. And you've seen this as I have, and both of us have come from different angles in one respect to the same kind of conclusion. And so I'd like you to share with me what you were thinking about 15 years ago when you had employees of insurance companies coming to you, and how that affected your perspective of the future of medicine.
You know, Dr. Rademacher, it really changed the trajectory of my whole life because I really was at that point becoming a doctor. I have a master's degree. I wanted to become a doctor, and I'm friends with many doctors like yourself. So when these insurance representatives were my patients and told me what was coming down the pike, I realized I'm going to leave college with over $100,000 student loan debt and then have to build a practice and with the insurance and all those things that are incorporated into this whole thing. And at that exact moment, one of my best friend's fathers was a doctor practicing at 90 years old, still practicing in Miami. And he told me, he says, Lisa, I have to see 4 times as many patients now than when I first started my practice many years ago because of what's going on in the insurance company. So doctors are having to kind of reinvent themselves and to also bring the joy back to the practice that you have. I mean, you're doing this helping people because you enjoy it, but I think I could speak for a lot of people who said, I don't enjoy it as much when I'm really constricted by what the insurance company is telling me. So they're opening up wellness or med spa divisions within their practice so they could bring this wellness component in and not just treat sickness, but prevent illness. And that's where MLD is starting to find its way in many, many offices. And I recommend that, and I thank you too for making this an opportunity for doctors to know about.
So what is that penetration right now? I mean, do you have any idea, what percentage of the doctors are really already engaging in this? And the truth is that, as you were describing to me earlier, this is another revenue model for doctors, and the benefit of that is very, very
Yes.
significant. And one of the reasons that I have my master's course is to help doctors appreciate their abilities and their central role in patients' lives, to actually be the educator and the introducer to modalities that can totally complement everything else that they're doing. This myopic focus on just strictly, especially with the specialists, are so strictly focused on their specialty and have no concept of what's actually happening around the patient and in other areas, and how all of that is actually contributing to their poor health. And so, kind of curious to hear from you then, how doctors can actually position this very effectively in their business, and how they go about doing it.
You know what, Doc? There's two elements here, and I think you are a really great example
for these physicians because you did. You became educated on it, you received it yourself, you implemented it in your practice. And the beauty, what I so appreciate working with you, and this is where my concern is that we're working with a lot of patients pre and post-op surgery. And I really, this is kind of a passionate plea to the doctors from someone who's been doing this 23 years. Please bring MLD on board in your facility, like Dr. Rademacher did, because in the incident that some patients having some complications, you're right there. You can oversee these things. And I can tell you there's a lot of practitioners out there. They're doing this in hotels. They're doing this in their own establishment. They don't have a doctor overseeing them. And there are times where patients really want to have this lymphatic drainage done in a secure environment with a knowledgeable doctor. They want you, is what I'm trying to tell you. And so this is that modality that basically all you need is a space, a room, a massage table, a certified practitioner. So minimal investment with a maximum return and many thank yous for giving that patient a safe avenue to pursue this lymphatic drainage. And please take Dr. Rademacher's master course. This is why he's designing this for you, because we really have not had one. We haven't seen this in the United States, but it's here. It's here now.
So really, you're you're introducing a very simple pathway for docs to enhance their own bottom line. And quite frankly, in this day and age, as I teach in the master class as well, is that when you look at the reimbursements for doctors, it's an ever decreasing, number. I think the average is about 7 to 10% per year. This is sort of like, okay, is it going to go down to zero at some point? I don't know. And then, particularly now with inflation, increasing so much, whilst inflation has consistently increased, so the cost of living and the cost of doing business consistently increases, our ability as physicians consistently decreases. And so the only way to make ends meet, if you will, is to, as you say, work, longer hours, see more patients. But then there's very severe consequences of that as well, and particularly in making it more difficult for us to be as thorough as we used to be. And and then of course not providing different types of services. And so in a way, there's such a build up of tension. And let me put the parallel to manual lymphatic drainage, right? There's such a buildup of tension that becomes at some point toxic and ultimately detrimental, not only for the doctor and their practice, but the patient. And so now if you kind of release it, with bringing in, say, manual lymphatic drainage, now not only are you releasing the tension to be healthier in your practice, but you're also releasing that tension that's causing all sorts of inflammation, toxic issues in your patient as well. So there's a duality here, if you will, to understand and appreciate the importance and how easy it is to bring it into your practice.
Dr. Rademacher, when we had the clinic down in South Florida, because we taught the manual lymphatic drainage certification courses. So we had professionals from all around the country and around the world would come through it, and they would walk through the clinic to get their first view of what an MLD specialty clinic really was. We've had several doctors. One of them was a podiatrist, and he came and he stayed an extra day or two with us, and he says, "You know what? I really enjoy this more than I thought I would. I'm going to go back to my state. I'm going to close my practice and open up the first lymphatic drainage facility and have all my podiatry friends refer the patients." And I've kept in contact with him, and it's so exciting for me to hear the excitement in his voice. He says, "I've got something to offer that is really undervalued until it's needed. And now people appreciate my practice, and all the other doctors do too, because they have somewhere where to send those patients." And he has a fully thriving practice. And let me give you a number too. So if you're wondering, we're talking about how this can enhance your practice. Me as a practitioner, I charge $350 for a 50-minute session in South Florida. And that is the going rate in South Florida, by the way, and in New York and New Jersey. National average is about 150 to 175 for a 50-minute session. So if you're needing to do some of the mathematics behind it, that's it. Is there enough patients? More than you can imagine. People are
all,
waiting 3 to
all of
6 weeks.
your patients, basically, right?
Yes.
So what would be fair? So if as an individual therapist who's got their own individual practice is charging 350, clearly a doctor's practice could be charging that amount. What would be the appropriate reimbursement to the practitioner then? I mean, what kind of percentages are you thinking about? Just to put into perspective for doctors who may now be considering, if you're considering it, what they can do right away and expect and decide what the projections are.
Okay, so there's two ways that a lot of doctors do this. Sometimes, and it really depends too, let me preface this, on the amount of experience of your practitioner. So if someone's a new practitioner, they'll usually start out with around $75 to $85 an hour. And there's still significant, about a third of what you're charging. A more experienced practitioner, a lot of times they'll do a half and half split. If it's in your office, they'll do a half and half split, the experienced practitioner. Sometimes the practitioners want or have their own establishment somewhere down the street. But again, I think that in the light of you being a doctor, if you have the space and these are your patients and you're recommending this daily, it'd be much better if it was in your office. And those would be the two options that are usually on the table.
So one thing that I've done in my past, depending on who I was working with, it's like a 30 or so, it's 30 to 70 split, either way. And so those, very well established practitioners, they would get 70 and I would get 30. And other ones, would be the converse. And at the end of the day, I think, it's more of a matter of, being realistic and being fair and understanding that a large percentage of very little isn't going to give you very much, obviously, but a smaller percentage of a lot, becomes very, very significant. And when we think in those terms, let's help everyone. The other part of that, which I think is important for doctors to appreciate, is this: is that depending on the structure of your practice, what is the space availability that you have, and how much of that space is actually being underutilized. And so it's a matter of, okay, it's a matter of proper scheduling and proper utilization of space, and making it easy for your patients to get access, to a therapist. And in addition, providing a nice home for the therapist who otherwise may find it difficult to get the clients. So in essence, it's a win-win for everyone, and there is no need to get greedy on this. And I think that typically, if you're coming from a place of scarcity, and if you're coming from a place, look, I'm just going to serve myself, it's not going to really work out for you. And so that has to be said, at first, and from
Yes.
the very, very beginning. This is about serving your community in the best possible way, serving your providers in the best possible way. And at the end of the day, you're going to win, magnificently in all areas. And so, a lot of this I do share in the master class, how to set up your practice. And, it's exciting that, you and I are developing a course, for doctors so that they can get effectively engaged into this practice and how to really help this practice thrive. But one question I have for you at this point is, what is that certification process that people go through? Because obviously, just like in any profession, including the medical one, a lot of people claim that
Yes.
they're doctors or they're therapists. What is that certification process, and what is your organization, more importantly?
So there are a couple different certifications for MLD that are out there. One is known as CDT, It's more familiar among occupational physical therapists who do lymphedema management, typically in hospital, in and out patient, that kind of thing. And I've done that work before, really enjoyed it. But the focus is going to be on the lymphedema population there with the compression wrappings and wound care. Then there is the course that we have is an MLD focus, where it is used for multiple populations. We're talking about pre and post-op. We're talking about the head, neck, and face and all the conditions, the central nervous system conditions for health and beauty. Then we'd cover mommy and me, the pregnancy and pediatric, professional sports and the clinical that's involved with that, because we've been working with pro sports for years now. And there's also clinical documentation that the practitioner should know how to fill out. And then for pain management, and especially with the opioid crisis we've had, particularly in Florida, we needed other options for pain management. And we've been very successful at bringing this in for drug rehab, as well as for hospice and pain management. So we cover ours in 5 days. And that's our bachelor level manual lymphatic drainage. So, and of course, now we're working toward the masters and trying to help some of our more skilled practitioners who are wanting to open up clinics who need further details. You are the product innovator, you are the inspiration, you're going to be the leader in your community. And if we can help you with some of those details from our experience, that's exactly what we want to do, because Dr. Rademacher said it. This is a recipe for success on all sides if it's done right.
So how do people find you?
Well, you know what? There's a couple different ways. Fortunately, because I worked for the doctor, I had a whole avalanche of all those patients in the South Florida community and the physicians that we've in service through the years, but also at a lot of the conventions for health and beauty. People will see us there. But also with MLD Institute being on all the social media channels, because this generation tends to want to go that avenue. That's how they find us: YouTube, Instagram.
So do you have a website?
We do. It's mldinstitute.com.
Great.
And
So
we are, by the way, putting up some new things. You will see a new site as we're working. So forgive us, we're under a little construction right now because we're going into several languages on this new website.
So what I think is important for people to recognize as you're listening in on this interview with Lisa Falco from the MLD Institute, and that is that she's a national leader, national trainer in the field of MLD. I've worked with her for many, many years. I've attended her courses, which are awesome and very informational and educational to the highest level. And I've also supported her more from the medical perspective. And she and I, as I mentioned earlier, we're developing a course, for practitioners specifically, ultimately for CME credits as well, which I think is great. But once again, it's really to emphasize the easiness, if you will, of implementing a thriving practice in your own practice, helping your bottom line, but more importantly, serving the community. And it's part of, for me, the bigger vision of what it is, of what the work is that I'm doing, and putting that in context. If you're listening to me for the very first time, is that I grew up in 5 different countries. I speak 4 different languages. I studied in 2 different continents, and at some of the most prestigious institutions, both in Europe and in the United States, including the Mayo Clinic in Minnesota. And it's really appreciating the bigger perspective or worldview of everything that we're doing from a health and wellness perspective. And so my point here is that as I too recognize the shifts in medicine and the politics and the economics and the logistics of medicine, starting 20 years ago when I went into practice, began to look at, okay, what are some of the solutions that will be very practical and functional for doctors in the future, and been working on this for the last 20 years. And which is the reason for this course as well, is to help doctors and practitioners embrace the ability to get access to different modalities that really support the overall well-being of the patient. And so rather than having this myopic view of your focus and your abilities to serve a patient, it's really, how do we actually expand that? And this expansion is essential, because without that expansion is that, we're underserving our patients in their desire to be healthy and well. And so that's where our responsibility has to come in. Once again, with the internet being the new medical compendium, with a lot of misinformation or information that's really difficult to process, then it's very confusing for patients. And so that's where, our highly educated path, right, is putting us in a great position. And like yourself, in our ability to really help our patients make the right decisions. Because let's be fair, most patients want to be told what to do. But unless we tell them everything, we're really underserving them. And once again, this is my push, for anybody listening in, is start looking at something pretty basic and simple to implement into your practice, because it will revolutionize your ability to support your patients in ways you never thought was possible. And so I'd like to invite, Lisa, to give her comments, follow up on that, but also share what she saw during the global pandemic.
Yes, right now, with all this change going on in our medical system, as I was saying, I started to see physicians gravitating toward more wellness-based programs, which actually is really a celebration of life. In my thoughts, is that thankfully we don't always have to just treat disease. There are people that want to be well and stay well, and I think now COVID actually did a good thing. It was a great awakening about the immune system for everyone, because everyone was wondering, am I going to get it? How bad am I going to get it? How do I prevent it? All those questions. And that's when we saw our phones, our emails, even till today, we were just bombarded with people wanting to know. And who do they want to know from? You, their doctor, is who they really want to know from. And so with that inspiration, Dr. Rademacher and we began a dialogue and said, we do need a class for doctors, because you've already graduated, obviously, and you're doing your CMEs. This is the perfect venue. And also it is the perfect venue in time, with, again, minimal startup in a small space. You can be servicing these people who are calling. I have people who've been telling me it's a 6 to 8 week to get a practitioner, and they don't even know if they're qualified. And this is where you can fill in, be the bridge in that gap, because people want to know, but they need you.
And the nice thing about this too is that it's either fee for service. You can also build insurance companies, depending on, the way your practice is actually set up. And so again, it's important to realize that at least 50% of our patient population are seeking alternative methods. And I don't necessarily like the word alternative, but outside allopathic medicine. And so there is a definite demand, and the implementation, as you mentioned earlier, is very, very simple. And so as we wrap it up, Lisa, one of the things, the emphasis that I think is important, for all of us to appreciate and really put in context to the world today is this, is that there's three revolutions happening right here now. First one is the wellness revolution, started in the mid 80s, where people are really grasping, all the modalities of wellness in general. The health of the population on one demographic is improving dramatically. On the other one, unfortunately, it's going the opposite direction, only because they're not aware of this. But certainly with all the types of modalities out there, it's increasing very, very rapidly. Now we've got the regenerative medicine revolution that's well underway, still very early on in the phases. And the regenerative medicine, the focus is on root cause. And a lot of the work that I do currently is on root cause. I've been in this space also for the last, say, 12 years. And quite frankly, very exciting because we're very excited because it really addresses the root cause rather than being reactionary as we've been taught, treating the symptom.
Yes.
And so clearly it's making difference. And the next one, which I'm not so sure people are quite aware of, but it's the bioenergy and technology and revolution that's just around the corner, and more of that later on. But the point of is that in the field of regenerative medicine, manual lymphatic drainage is an important part in our ability to be healthy and to be well. Lisa, I'd like to give you the last word.
So my final words would be, please remember, lymphatic drainage, it's happening every day, whether poorly or perfectly. And we have a modality that's gentle, minimal side effects, and we can do this for a wide variety of patients, from your youngest, like 2 days old, to someone up in their 90s. I got to be honest, as a therapist, I have not seen many modalities that you could use on such a broad spectrum for a population that's needing it, wanting it, asking for it, that you can service. So we do hope that you'll join us in this master course so that you could see how beautiful it is.
And with those
Bring
words,
you up to another whole level.
and with those beautiful words, Lisa, thank you so much. And understand that this interview is redirected to both practitioners and the consumer. It's all very relevant in our world today. And, it's so helpful to have access to such easy modalities, affordable modalities that really will dramatically change your health and well-being. And it's up to us as physicians and practitioners to be able to provide as well. I'm Dr. Bart Rademacher, and this is Prescription for Your Transformation: Real People, Real Conversations, and Real Success. Bringing to you how to get access to the brain, the body, and the energy intelligence based on science and based on personal experiences. And it's all for you to decide, whether this is relevant for you or not, and for you also to verify so that you can make the right decision for yourself. I'm Dr. Bart Rademacher, and I'll be back. Thank you.
Thanks for joining us on another episode of Dr. Rademacher's Prescription for Your Transformation. Continue the path towards discovering your own authentic genius by tuning in next time for more real conversations with real people.